First of all, I thought I would start by introducing myself since I am new to all of this. I wanted to give you a few minutes to just get to know who I am. This gives you a timeline of how I started. I did undergraduate and graduate school in the Northeast, and then, as my husband likes to say, we started our march west. I did my fellowship and my residency in Cincinnati. Worked at the University of Michigan in their School of Medicine for about almost 6 years, and now have landed at the University of Kansas. Just a little bit more, I am very interested in how eating behaviors and nutrition affect and interact with chronic illness in young kids. I have published about 22 papers just looking at feeding and eating behaviors in young kids, primarily in type 1 and type 1 diabetes and cystic fibrosis. I have NIH funding looking at eating behaviors, and over the course of this work, I have probably watched over 300 meals of young kids eating. So a lot of what I'm going to be talking to you about are things that I see people do, and things that I see work, and things that I see that don't work. If my kids were here, they'd just say it in one word. I am obsessed with eating. So today's objectives, we're going to start with a little bit about feeding development. And actually, I think what I'm probably going to do is jump through this part very, very quickly, because I'm getting the sense from talking with folks that what we really want to hit on with enough time is the challenges that you see in eating for young kids, as well as how to address those challenges. But before I get started, I wanted to talk a few minutes about today's format. I'm standing at the podium, and I'm sorry, can you not hear me?
Not all the time. Your voice drops down a little bit.
Okay.
We're having a little trouble back here.
Okay.
Do you have the lavalier on?
I don't, because I don't have a waist.
Oh, okay.
Yeah. I wore a summer dress, and I didn't realize I wasn't going to have a waist. So I'll try very hard not to walk away from the microphone. Okay. I'm standing at the podium, but I really don't want this to just be a lecture. So what do I mean? I don't want this to be me talking to you, you listening, but there's no interaction. And I really don't want it to be this kind of lecture, where you feel admonished or you feel uncomfortable. What I'd like to think about is whether we can make the next hour or so more like a workshop. So something that's engaging, something that there's an opportunity for discussion and questions, and an opportunity for you to feel like you're walking away with new skills. So lecture is no, not for today. We're going to try for a workshop, which is going to have that nice engaging moments where we have some discussion, some opportunity for questions. And I think this works better because it's summertime. Nobody wants to go to school in the summer. And I am very familiar with always being the talk right before lunch. So I think this works better when you're the talk right before lunch, too. So jumping through, at times I'm going to throw out this term eating competence, and I just simply want to give you a sense of what I mean by that. In the literature, we think of eating competence as involving not just a child being able to have all the behavioral pieces that are composed in eating, but also the social interaction, the modeling, as well as the praise and the reinforcement that can come in eating. Now, this is a really busy slide, but what I really like about it is it puts into perspective all the things that kids learn in the first 2 years of life. So we're born with this innate sense of sucking, rooting. These are our innate and our early eating skills. And that works well for a while. But over time, we need to develop more skills, and those develop over time. And with the introduction of there's changes in our bodies. We start to grow teeth. There are changes in our energy needs, as well as developmental changes. We can sit up, we can hold our head up. All of those things perpetuate these changes in feeding and eating behaviors. So that by the time about 24 months, kids are pretty competent in eating and can often eat independently. Now, these next few slides are part of your handout, so I'm not going to really spend much time talking about them, but simply to just say that in the feeding literature and in clinical care, we divide feeding into stages. So there's 5 stages that we define, stage 1 being infancy, stage 2 being when we introduce the semi-solid foods, and that usually occurs about 6 months of age. We have stage 3 and 4, which is between 6 and 12 months with your toddlerhoods, is now you're starting to introduce the dissolvable solids, things that kids can crunch, but you're still not anticipating that they have fully developed the tongue skills and all of the coordination to fully swallow without fear of gagging or choking. And then at about 5, we see the introduction of a more adult-like diet. So the kids transition to having more calories coming in with solid foods, less calories coming in from milk or formula. And then some people actually also conceptualize the stage 6. And the reason we bring up stage 6, while all the feeding behaviors are in place, so we know that they have developed the skills for feeding, what feeding often becomes in stage 6 is a social activity. So there's a lot more social referencing, a lot more modeling, opportunities for kids to learn good eating behaviors as well as less adaptive eating behaviors. So there are a lot of common feeding challenges that we see in young children. And I've named some of the ones that we see the most often. So we have neophobia, limited food variety. We have limited food intake. We see problems with a limited attention span at meals as well as disruptive behaviors. So in talking about neophobia, there's this really interesting paradox that we think underlies how neophobia gets started in young kids. And neophobia is and we're going to talk about it, it translates obvious fear of new, and in this case we're talking about fear of new foods. So there's this phenomenon we call the omnivore's paradox. So as Dr. Schwarzenberg noted, we are omnivores. We can eat anything. We can eat meat, we can eat vegetables, we can eat fruit, we can eat grains. And this has a wonderful evolutionary opportunity for us. We can live in multiple settings and environments, and there are a lot of advantages to it. But while we can eat a whole lot of stuff, we might not want to eat a whole lot of stuff. And actually having more opportunity and more things that we can eat also increases our likelihood of eating something that's poisonous, something that could kill us. So we all have this innate sense of self-protection, and we all have this omnivore's paradox that we play out. Rats also, by the way, are omnivores, and we see this with rats as well. So why are young kids prone to neophobia? Well, we think it's that underlying omnivore's paradox. If you think about a young kid, everything's new. They have very limited food history. They don't social reference as well, so they're not taking as much information from, well, I'm watching my mom eat it and she's not dead yet. They're not thinking about that. So there's limited opportunity and a strong likelihood that there's going to be a distrust of new foods until they develop a liking of that food or a familiarity with that food. So I wanted to show this graph because I thought it was very interesting. I'm going to try to point and talk, so hopefully I won't go down and you'll still be able to hear me. So this is the potential lifespan model for neophobia in kids. And you can see that it's very uncommon when you're first born. It starts to increase over the first year. It has its peak between 2 and 6 years of age. So right around the time when kids are exploding in terms of the types of foods they're eating, because they're in their preschool years, that's when we tend to see it to be the most problematic. And then with greater food history as well as social learning, we start to see a decrease into adulthood where it tends to be at a pretty low level, all things considered, until maybe about the point where we start to become much older and elderly. And then we do tend to see some older folks having neophobia again, often related to health issues or because their taste, their sense, their eyesight is poor. So they have a more natural distrust of food because they just simply can't perceive as well if it's good food, bad food, if it's spoiled or not spoiled. We also tend to see that neophobia is more common in kids who are more anxious. So if you have a child that's a thrill seeker, we tend to see less neophobia. But if your child that tends to be more anxious, maybe takes things a little bit slower, is the kind of kid that's going to put their toe in the water before they jump in the water, then we might see more neophobia in that child as well. The important thing about neophobia is exposure. And I think this is where some families don't have all the information. It can take up to 15 or more exposures of a food for a child to develop a preference. And so even though it's a new food and a child may seem like they don't like it, without that 15 or more times, you really can't make a decision at this point, is this a food that my child's going to eat, or is this a food that my child has decided he or she is not going to eat because of preference. And it's important that the exposures involve taste. It can't just be, oh, it's on the plate. It can't just be, well, he saw mom eat it. The child actually has to try the food themselves, which is an important part of that exposure activity. So now, how is limited food variety different from neophobia? limited food variety or picky eating is actually much more severe than neophobia. So in a case where you have neophobia, the child's tendency is not to eat new foods, but they'll eat a whole lot of other foods that they've now developed a preference for, and that's part of their food repertoire. In the case of a picky eater or a limited food variety, now you have a child who has a very limited food repertoire, and that may not include new foods, and it may also not include foods that they once previously ate, which can be very frustrating. So taking a similar model, this time looking at what if we were to try to introduce fruits and vegetables in a child who had neophobia symptoms versus a child who's a picky eater. You can see the dotted line is the child with neophobia, and you can see that with the number of presentations, the refusal rate goes down. So until we would presume that the child develops a preference and is willing to take the food. But in the case of a picky eater or somebody who has limited food variety, we don't see that. You can try multiple presentations and the child simply doesn't change in their rate of refusal. Unfortunately, picky eating is very common. In this project, they interviewed parents, and they found that among parents of 19 to 24-month-old kids, about 50% of parents said their child was a picky eater. And you can see that this increases over time, so there's fairly few picky eaters at 4 to 6 months, up to 50% by 19 to 24 months of age. And the other thing about picky eating is it's self-sustaining. So in this graph, what they looked at is how many times do you try a new food with a family? Now you recognize your child's a picky eater, how many times are you going to be presenting foods? And you can see that most families really give up after, now I'm really having trouble, after about 3 to 5 presentations. And so we know 3 to 5 presentations isn't enough. If we're trying to decide, is this a food that my child could develop a taste for and it's just neophobia, or is this a food that my child's never going to like and it's picky eating, you need to give it more than that 3 to 5 times. And so for that sense, I see a lot of kids who have picky eating, and what I find is that kids are refusing the foods, mom and dad take that information and they stop presenting it. And so in that way it becomes self-perpetuating. The child never has that opportunity to expand their repertoire. Now, variable food intake, I think, is probably the most frustrating for families that I work with when they're trying to watch calorie counts, particularly in cases where kids are underweight. I do some work with kids with cystic fibrosis, and parents are really trying to work on increasing their calorie intake because they want these kids to gain weight, they want them to grow better. And unfortunately, variable food intake is part of being a kid, and especially a very young kid. And it was first documented in the 1930s by this person, Clara Davis. And she noted that without adult intervention in these preschoolers she was taking care of, that while the amount of food that they ate at each meal tended to vary, they tended to get about the same amount of calories over the course of the day. We've since replicated that study. This was a project that was done by a researcher out of the University of Pennsylvania. And actually, I'm sorry, she's out of Penn State. Big difference. One's Ivy League, one is Big Ten, I know. So she had 15 preschoolers. They were normally developing preschoolers, and she had them eating a set diet that she would give them. So she would send them home with food on Tuesdays and Wednesdays, and she did that for 3 weeks. So the same lunch they got the same lunch every Tuesday for 3 weeks, the same lunch every Wednesday for 3 weeks, so on and so forth. And she measured their calorie intake for those meals. And what she found was even if she was, for example, feeding the child macaroni and cheese every Tuesday for 3 weeks, the amount of macaroni and cheese that child ate was different, week 1 to week 2 to week 3. Same exact food, but their appetite at that point was different. And that individual meals, the variation could be as much as 34% in terms of calorie intake. Super frustrating if you're trying to think about getting 600 calories in your child and it's lunchtime and they're only seeming to want to eat about 400 or calories, but still very common in these young kids. But when she found, even though that the variation of meals and calorie intake at meals was about 34%, when she looked at the overall daily, it was only about 11%. So they had very little fluctuation in terms of the total number of calories they ate over the course of the day, but very large differences in what they ate meal to meal. And this graph simply puts that in a different perspective in terms of the coefficient of variation. What I thought was interesting is she found the greatest variability was afternoon snack, whereas some kids would have an afternoon snack one week and then they wouldn't, so the variation was as much as 100%. Now this is again without any kind of behavioral strategies, any kind of intervention. This is just free living for the child. We're going to talk about some behavioral strategies which I'm hoping can help with minimizing some of that variation for mealtimes, because that's something that we work very hard on. So what about disruptive behaviors at mealtimes? What do you all see? All right, so let me recap, because in case people didn't hear. So your son's getting a preload of calories before a meal through the G-tube. And at mealtimes, he is refusing food, he's tantruming perhaps, or certainly being disruptive.
Right.
Yeah.
And we have the feeding schedule set up so he would be hungry. So he's getting his formula hours before his meals. So he should be hungry.
Yeah.
And he only has certain safe foods that he will eat.
Uh-huh.
They're not very nutritious foods. And that's kind of where we're at.
Yeah. Okay, so he is disruptive, he's refusing foods, he's negotiating what he will eat and what he won't eat.
Yes.
What else? Anybody see it? What else? Oh, yes. Don't have to pee any other time of the day, but as soon as you sit down, it's like, boom. There's actually a reflex, the gastrocolic reflex, where, you know, we call it the Thanksgiving dinner. It's when this probably shouldn't be on videotape, but it's when you have to have a big bowel movement after you've had a big meal. That sometimes does happen, but I see that quite a bit. What else?
We have problems with if it doesn't look the same, even if it's macaroni and cheese, it's got to look a certain way, he will not eat it.
Oh, yes. Yeah.
I mean, in a jelly sandwich, if the crust isn't cut off and it's not the right kind of jelly, it's over. I
Yeah, so limited food variety and picky eating. My kids always ask me, what's the green stuff in the food? And I said, it's parsley, you can't taste it anyway, but they won't eat it. What else?
He loves to do everything except eat. During meal times, he'll start talking about what happened in school. He'll get up and walk around the house. He'll say, oh, my shirt is wet, I have to go change it. Everything but eat.
Yes, stalling. Stalling is another common one. You can't stall unless you're little. Yes.
What's up with your mashed potatoes can't touch the meat, and the meat
Yeah,
can't touch the
yeah.
peas, and the salad can't go on the same plate?
Yeah.
Yeah.
Okay, presentation, that's big.
I'll throw a wrinkle in. Whether they're FA or not, stand up, sit down, stand up, sit down, stand up, sit down. They never
Yep,
sit
away
down.
from
They
the
gotta-
table.
Right.
Yep.
My daughter, she tends to drink instead of she wants to eat. She just,
Yes,
I want
thank you.
milk, I want milk.
I'm sorry, please finish your thought. That was the next one, that was the one I was waiting for, because I have the next slide, which lists all of those. I was waiting for the one person who would say drink but doesn't eat. So, and I'm sorry if I'm seeming overly excited about a problem that you're frustrated with. And so the good news is, okay, maybe it's not good news. The reality is that all kids engage in these behaviors. What I find, though, is that in study after study after study, the kids that have where food can be a medicine, where they really are, people are focused on trying to help them eat because they know they need to gain weight, or they know they need to eat, like in the world of type 1 diabetes, where you need to eat this amount of carbohydrates because we gave you this amount of insulin, where there's that kind of structure built on the meal, we see a lot more of these behaviors. And they're really frustrating, and they're really stressful for parents. So this is a project that I did in type 1 diabetes kids, and I just want to run through. We asked parents, what are problems? So I know these seem like these are positively stated statements like, we'll try new foods, but the parent is going to tell me, is this a problem? i.e., does this happen, yes or no? And so in this case, you can see that about 24% or a quarter, or 26%, or about a quarter of the families that we interviewed said their kids don't try new foods. That's a real problem for them. Meals take really long, over 20 minutes to finish. That was about a third of these families were reporting that. Kids don't want to come to the table when it's time for meals. 20% of parents were telling us that. Kids are tantruming at meals. Kids are spitting out food or refusing foods. They're not hungry for what I'm giving them at meals, but they're immediately hungry after, and they're negotiating for what they want to eat. That is also very common, and these are what parents are telling us. And when we actually started videotaping meals and looking at them, we see that this is in a sample, 3 samples of kids with cystic fibrosis. We see that this is in terms of like the percentage of time. You know, kids are spending a huge amount of time talking. And when you're talking, you're not eating most of the time. I'm okay with the talking with your mouth full because I'm trying to get these kids to eat, but they don't do that. They talk instead of eat. They're also away from the table quite a bit. They're complaining about their foods. They're refusing bites and sips from mom and dad. And this is whether they're toddlers, they're preschoolers, or they're school-age kids. And the school-age kids sample went up to 11. All right, so what do we do about this? So most of the intervention research has been done in kids who have cystic fibrosis. I did a whole lot of research trying to figure out if I could find some information specific to kids with FA. And unfortunately, there just isn't any research that's been done yet around feeding and eating with kids with FA, at least as best as I can tell. And I did a lot of research to try to find something. But I think CF makes a nice opportunity to talk about what seems to be working and what doesn't seem to be working for a few reasons. For those of you who aren't familiar with cystic fibrosis, it's an inheritable disease. It's actually the most common inheritable disease in childhood. It's an autorecessive disease, so that you need to have both parents to have the disease, or to have be carriers of the disease for a child to have the disease. Kids who have CF, they produce this very thick, sticky mucus, and it over time destroys the pancreas and the lungs. So the impact from the pancreas is that they stop producing these fat-soluble enzymes, so they have difficulty digesting their food. And the problem with the lungs is they trap infection, which leads to lung cell death, which over time leads to the greater likelihood of morbidity and mortality. They also have poor oral intake. They have poor weight gain. And they need to consume about 120 to 150% of the RDA for calories each day. And that can vary somewhat also be based on their disease status. So if they have greater lung involvement, they may need to eat more calories just to try to grow and to stay healthy. Unfortunately, we've been doing research in CF for quite a long time, and without treatment, we find that these kids don't tend to do a very good job with meeting those calorie goals. So here you see, in toddlers, we see on average, about 11% meeting that 120% RDA. In preschoolers, we see about 20% meeting that 120% RDA, and in our school agers, it's only about 34%. So there's a lot, even though there's a lot of room for intervention for these families, because without intervention, we're seeing that they struggle. So what kinds of things have we been doing? This was a trial that was run with preschool-age kids. There are about 70 preschool-age kids, and they were randomized to either a nutrition only, where they learned about what kinds of high-calorie foods they should be feeding their kids. So again, you want to be having your kids eating foods that are high in fat, because fat has more calories per gram than sugar. They were giving them specific goals per meal. They wanted them to consume about 400 calories more at breakfast, lunch, and dinner, and about 200 calories more at each snack to achieve those goals. That was the nutrition only. And then they had the second group, which was nutrition only, which was nutrition, so they got all that same education, but they added behavior management strategies. So they worked with the parents to teach them some strategies to help them at meals, to make the meals go easier. So some of the strategies they did, which we're going to talk about, contingent attention. They did goal setting. They used a token economy. And they worked on mealtime hygiene. And you can see, when they ran these kids pre to post, at pre, none of them were making that 120% RDA goal. They were all about 100% of their RDA. But at post-treatment, both of them improved. So just nutrition alone helped these kids. They got up to about 120% of their RDA. But when we provided the behavioral on top of the nutrition, kids got up to 150% of their RDA, which was awesome. Both groups maintained their gains over time, but again, we saw a slight improvement for the kids whose parents got the extra behavioral strategies, got that extra help. They've since gone back and looked to see, well, what kinds of factors baseline seem to predict better outcomes. And what I wanted to point out here in these next two slides, one of the most significant predictors of outcomes was whether the parents reported mealtime problems. So parents who didn't report mealtime problems tended to have kids who had greater calorie gains over the course of treatment. And they tended to gain weight more from baseline to post-treatment. So mealtime problems, if we don't address, they seem to impact treatment, and they seem to be an important thing for us to consider as we're working towards boosting calorie intake through other nutrition education. So the strategies, again, that they talked about that worked most effectively in that intervention was contingent attention, setting goals, giving commands, the token economy, and mealtime hygiene. And we're going to go through each of these. We're going to talk about them. And this is an opportunity also, I'd like to hear from you some information. So contingent attention, who's heard of it? Anyone? Okay. Well, what is it? Contingent attention is a way to systematically give feedback to your child based on their behavior. So the feedback is given immediately after the behavior, and if it is a positive behavior, the feedback's going to be praise and rewards. Great job, good work, I like how you did that. If the feedback is negative, or if the behavior is negative or is an undesirable behavior, then the feedback is ignoring or withdrawing attention. So the praising piece. Young kids love attention. Even my 15-year-old likes attention. I just have to be careful about how I give it to her, because if I give her too much, then she's like a cat. She'll get up and walk away. But every kid loves attention, and it's how you give that to them that is important. You always want to be there to, as you can, praise the behaviors you want your kids to repeat. That is very, so at mealtimes, what do we want them to repeat? We want them to come to the table. So if you call, hey, Johnny, it's dinner time, and Johnny actually comes to the table, hey, I like how you came to the table, right? I didn't have to call you a second time. That's awesome. Give them feedback for that. Taking bites of food, tasting or trying new foods. If you have a picky eater and you want to establish a rule around taking bites of new foods, you need to also give them praise and feedback for the behavior, for trying that new food. Listening to snack suggestions. In the world of CF, I've never seen so many salad eaters. They love salad, but salad doesn't get us anywhere because there's no calories in salad. I wish that when I move over and do weight management, I wish those kids loved salad as much as the kids with CF. So we give them snack suggestions, things that have a little bit more meat to them than salad. And if the kids listen and they go along with it, then we give them feedback for that. Great job, that was really good thinking. You can get more calories and you can be, if you have your power milk versus your regular milk.
It's pretty odd. Those kids like salad.
Yes. And I think it's because they get so much attention for eating salad. When they get salad, mom and dad are saying, well, you shouldn't be eating the salad. It doesn't have very much to it. I really need you to be eating the mashed potatoes that we added all the sugar, all the butter and the fat to. So they get a lot of attention for doing something that the parents might not want, and we're going to get to why that might happen. So the opposite of attention is ignoring, withdrawing attention, and this is where I think we get into this trap. Has anybody ever heard of the saying, the squeaky wheel gets the grease? Yeah. When I was, I don't think they were on the plane. Maybe I'll check. Okay, when I was flying from LaGuardia to Portland, the family in the row next to me had a little baby. He was probably about 3.5. Mom was sitting next to him on the airplane. This is, by the way, why child psychologists are the worst people to have at cocktail parties, right? Because everybody's afraid you're going to be analyzing their kids. Anyway, there's the aisle, mom and kid. I'm sitting right here. I'm trying really hard to read my book. And the little boy is kicking the seat in front of him. Kick, 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 kick. And mom says, honey, stop kicking. And the boy stops kicking. And the mom goes back to reading her book. And the little boy does what? He starts kicking the side of the, kick, 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 kick. Mom says, honey, you're bothering the people in front of you. Put your feet down. Goes back to reading her book. 10 seconds didn't go by. Kick, 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 kick. Mom says, you really need to stop. They're going to get upset. Little boy stops. What's going on here? What's he getting attention for? He's doing something undesirable. We try to avoid the word bad in psychology. We talk about bad choices. We try not to talk about bad behaviors. But he's doing something undesirable, absolutely. And mom is only paying attention to him when he does it. The rest of the time, she's reading a book. Now, there's a whole lot of things that are wrong with this. First of all, he's 3 years old. He can't sit there and entertain himself. Mom should have given him something to do. But the second thing is that mom is totally reinforcing the wrong behavior. So how often do we fall in that same rub? We do, right? Don't play ball in the house. The kid's still playing ball in the house, right? We all do that. So we have to be very careful that when we're doing contingent attention, we're not inadvertently rewarding the wrong behavior. And I think that's what happens with salad, is the foods that don't get the kids anywhere, they eat because everybody's sitting there telling them how, well, you shouldn't be eating it. This isn't really going to help you. And they're putting too much attention on that behavior. And I think that's one of the things that maintains that. So examples of things we should try not to pay attention to at meals. Complaining, dawdling, or stalling. We're going to talk about how to address that, but ignoring it isn't, you don't want to address that with attention. Not eating, or any efforts to draw attention away from eating or the meal. So now, what isn't contingent attention? It is not a bribe. Let's talk about what a bribe is. A bribe is something such as money or a favor offered or given to somebody to act dishonestly. Eating is not dishonest. Eating is important for our health, so it's not a bribe. It's also not a coax. A coax is when we give flattery to try to gradually change or persuade behavior. We're not doing that with contingent attention. And one of the big differences between contingent attention and a bribe or a coax is that in the case of a bribe or a coax, when does the parent behavior occur? It occurs before the child's behavior. But in contingent attention, when does the behavior occur? It occurs after the child's behavior. So have any of you ever seen those gangster movies and the guy says, hey kid, here's $20, go watch down the street for the cops. That's a bribe. Gave the kid $20 before the kid went to look. He would be much better off if he said, hey kid, go look for the cops and when you come back I'll give you $20. That would be contingent attention. All right, so again, contingent attention, you have the child's desirable behavior, you give them praise, the child repeats the behavior. In the case of the undesirable behavior, whatever that might be, you withdraw the attention, the child decreases that behavior. In each case, the parent acts in response to the child, and that parent's behavior gives feedback to the child. If you give attention before the behavior, who knows what the kid's going to do? Who knows in the case of here's $20, go look around the corner, if the kid's actually going to go look around the corner or they're going to run the other way? I don't know. The kid's already gotten the reward, right? So there's no opportunity for feedback because the parent there's no response. There's no chance for the child to now learn from what the parent's telling them. So we don't want to do that. That's wrong. That's not going to get us where we want to be. And now, I'm going to show you some video clips, but I'm going to do it afterwards because it's just clunky going back and forth. So we're going to show a couple of video clips showing some contingent attention in the context of meals, and we're going to have hopefully about 5 or 6 minutes at the end to talk about it too. All right, so what are some ways to praise your kids? So the obvious and the easiest is to give them verbal praise. Tell your kid quickly what you liked. I give you some examples. I like it when you come to the table right on time when I call you. What's nice about it is it's very specific, and it's a nice praise statement. Give them one-word quickies, like good job, great, high five, whatever. Something that's going to make them feel good. Or you could do, if you really want to be fun, you can do like a play-by-play. So find, as I have here, find your inner Howard Cosell and sit there and say, wow, let me think of an example one. Oh, look, Sarah's picking up a toy. She's got one toy in her left hand and one toy in her right hand. Now she's running to the toy box. She put it in the toy box. Now she turns right around and goes back out and gets 2 more toys. Do you think she can get 2 in her left hand? Oh my goodness, she got 2 in her left hand. And she's running back to the toy box and she's putting it in the toys in the toy box. Kids love that. And they go faster and faster and faster and they get more excited because you're giving them attention for what you want. In my clinic, we talk about the ABCs of praise. It's kind of boring if you say, good job, good job, good job, good job. I do that, I fall into that. Excellent, nice. So we give out this handout. Let's think of some fun ways to say good job, other than just saying good job over and over and over again. So this gives you some, I always challenge my parents, these are ways you can praise your kids based on the alphabet, and I love new ideas. So if you think of new ideas, please let me know, because I'm really kind of low on V. That one, I need some new ideas for V. X is cheating, but I need some new ideas for X if you all have any. J, who knew J was so hard? But J, that's a hard one to come up with too. So any ideas you have, I love them. So behaviors to praise. At mealtimes, we're going to praise coming to the table readily, sitting and staying at the table, so it's not up, down, up, down, up, down, taking bites of foods or trying new foods, eating quickly, and accepting our edibles or spreadables. And in your case, it would be eating instead of drinking, which we're going to talk about. We're going to be working on that in a little bit. But you can also praise other behaviors. Everybody in the family probably has something they could be working on, even if it's not food. And that's what you do with your siblings. So think about, well, how do we use praise and attention to reinforce good manners, or to reinforce cleaning up after themselves, or to reinforce whatever chores or jobs you want other kids to be learning as well. So let's talk about goal setting. So Yogi Berra has said it best, if you don't know where you're going, you're probably going to end up someplace else. And that's why we set goals. When we talk about goals in the world of psychology, we talk about SMART goals. SMART goals are specific, they're measurable, they're attainable, they're realistic, and they're time limited. So I'm going to give you some examples of some vague goals. These are things I hear when I ask kids to tell me what their goals might be, or parents. So a vague goal might be, encourage my child to eat new foods. I'm not sure I know what that means. Another vague goal is encourage my child, but a little bit more specific, encourage my child to eat more vegetables. How do you define more? Would be my question if a parent asked me that. Or I want my child to eat better. I hear that quite a bit. Well, what does eat better mean to you? Would be the next follow-up question I'd have. Or I want my child to gain weight. So smarter goals and things that we work on in clinic is thinking about making these goals that are vague more specific and more measurable. So for example, we're going to target one new food at dinner, and we're going to keep this goal for 2 weeks. Does everybody know what our job is? It's pretty specific, it's measurable. If you didn't get that food, you didn't get work on that goal. It's time limited, so you're only going to do it for about 2 weeks, and then you're going to reevaluate the goal. You might need to modify it, for example. I'm going to add a vegetable on my child's lunches this month. That would be a more specific goal. The thing about SMART goals also is I think it's very important to focus on behavior versus outcomes. And the example I like to use in clinic is winning the lottery. How many people here would like to win the lottery? I'd love to win the lottery. But you know what? If I set my goal as I'm going to win the lottery, that's probably pretty hard to do, right? That's an outcome. I have a secret, though. I'd love to win the lottery, but I don't buy lottery tickets. So what's the likelihood that I'm going to ever win the lottery? 0. So the behavior I need to work on is buying lottery tickets. That's within my control. And if I buy lottery tickets, then I have the infinitesimal slight chance of actually winning someday, right? So that's what I mean by behavior. You want to reinforce behaviors, not outcomes, because behaviors are what we have under our control. So eating more at meals, eating different foods at meals, those are behaviors. Gaining weight when you get to the doctor next time, that's an outcome. And that's something that we hope the behavior will drive, but it's not what we're going to reinforce or what we're going to set as our goal. We want to strive for shared goals. This is really important. If it's just your goal and you haven't gotten buy-in from your child, you're going to be dragging your child across the finish line the whole way. So you need to work on goals that you both mutually agree upon. It also makes it a lot more fun. And then it's very important to take the time to recognize when goals are achieved. That goes back to why we want time-specific or time-limited goals. It's not, you're going to eat this way for the rest of your life. It's let's just do this for a week and see how it goes. We'll reevaluate it then. A week is so much more manageable and so much more, it gives you that opportunity to come back and say, okay, what's working, what isn't working, how do we make this different? Questions, anybody? Or you want me to keep going? Okay. Command statements. This is one of my favorites. So how do you give directions to your kids? Do your directions ever sound like this? I need you to finish eating all of your carrots, okay? Who does that? Yeah, right, okay. It's time to pick up your toys, okay? Oh, my favorite, I catch myself doing this sometimes. Okay, especially when we're in a hurry. Run upstairs, grab your hairbrush, a ponytail holder, bring down the conditioner bottle, and don't forget you're going to need a hoodie before you leave. Does anybody do that? Oh, yeah. And what do you come back with, by the way? When you give that command to your kid, do you ever get 2 out of 3? No. If I give that command to my middle one, she just stands there. She doesn't know what to do. See if you can eat more. Anybody give that command? All right. Come on, Jimmy, come on. Who says that? Did you know in America what the #1 command is that we give our kids? What? Hurry up, that's a nice one. Stop that. That's a good one. You hear that a lot. No, you know the #1 command we give our kid is, come on. What does that mean? So command statements, we need to make them more effective. They should be short, they should be direct, and they should have one thought. Eat your sandwich, take a bite. They should be positively phrased, not negatively phrased. The other thing that Mom did on the airplane is she kept saying, stop kicking. The only thing that little boy heard was, kicking, kicking. And we have to recognize that our kids censor us. They don't listen to every word, even though they should hang on every word we say. They don't. They hear what they want to hear. So when you say, don't run in the house, and then they probably heard, run in the house. If you say, don't throw the ball at your sister, they heard, throw the ball at your sister. That's what they wanted to hear. That's what they heard. So we want to do positively phrased, not negatively phrased. So we don't want to do don't run in the house. We want to say walk in the house, because that's what we want them to hear. The little boy on the plane should have heard, keep your feet down. That would have been the positively phrased. And we don't want statements to be questions. Unless you are truly meaning that the child has a choice, they can say no, then don't make it a question. Because you are going to get the kid, usually around 4, when you say, would you like to eat your vegetables? And they say, no. And then what do you do? I get this, one of the things I do is I help with a GI clinic. And we have these kids who have chronic constipation. And I can't tell you how many times parents say to these kids, do you want to go to the bathroom? And they do that all the time. Do you want to go to the bathroom? And 9 times out of 10, the kid says, no. Or, do you need to go? No. You know, and we all know the kid needs to go because we can smell it. But they didn't ask, they asked the question. And now what do? Do they say, well, you're going anyway? So don't ask a question unless it's really a question. So let's practice. How could we make this a better statement? No touching. Keep your hands to yourself. Keep your hands to yourself. Hands down. I like that one. Yeah, do not touch is still again, a negatively phrased. You need to eat all of your dinner, okay? Finish your dinner. Somebody said that. That's a good one. Yes, eat your dinner. Same thing. This snack is good for you, okay? Ooh, stumped you. What's that? Please finish your snack. You can always say please, but yes, eat this snack. Your commands don't have to be like Army drill sergeants. You can say please. This is also something we see a lot, which is called a coax. I think if I could interview every 3 or 4-year-old kid, he'd say, yeah, I don't really care if my mom thinks it's good for me. If I don't want to eat it, I'm not going to eat it. But we do that. This tastes really good. You should try it. That's a coax. And we spend quite a bit of time trying to work with families to teach them not to give coaxes, but to give good commands. How about this one? How about you try your broccoli now? Please take a bite. Or try the broccoli. Yeah. Okay. For my daughter's sake, run upstairs, get your comb, a ponytail holder, and the conditioner. What would be better? Breaking it up. Go get your comb. Go get the ponytail holder. Go get the conditioner. Other things that are good best practice, you want to make sure you have eye contact with your kids. If they're not looking at you, they're not listening to you. Unless you say you're going to Disney World, and then they'll hear that no matter where they are in the house. You want to be specific and tell the kids exactly what you want. And you always are more effective if you pair your commands with contingent attention. So, go get your ponytail holder. Oh, thank you, you got your ponytail holder. Or, hey, you got your brush and your ponytail holder. I didn't even ask you for the brush. Awesome. Good thinking. That's going to make it go even farther. So everybody knows what the home economy looks like, right? You go to work, you complete tasks, you get rewarded for the tasks you complete on payday by getting a paycheck, and you turn that paycheck into something you want or something you need, like paying your bills. But it's there to finance your activities, it's there to finance your lifestyle. That's our home economy. So the toke economy works similarly. You have a target behavior, which you've defined. Your child completes the tasks related to that target behavior. Upon completing the tasks, they earn a token, which they can later turn in for something that is more desirable, something that they're excited about. So we want to increase oral intake. That would be an example of a target behavior. We want to meet goals during meals. That would be, and we award tokens as they do it. That would be the example of the immediate outcome. And they trade in those tokens for something that is attractive, realistic, limited, and mutually beneficial or acceptable. By that I mean you want to give them something that they don't have access to already. So if they get to watch video games or play video games all the time, then why would they work for you to do video games? You want something that's time limited because you want to be able to take it away so the next day they're motivated to get it back. You want something that is mutually acceptable because if what you ask them to do is something that's going to drive you crazy, you're not going to want to reward that to them, and it's going to increase your stress level. And you want it to be realistic. I love doing goal setting with kids when we talk about the token economy, because that we'll be working on, I'm going to be drinking more water in the day, and I'll say, and what do you want to earn towards that? And they always say, I want $20. It's like, Yeah, I do too. To drink water? Totally. I'll take $20. But that's not realistic. Or sometimes the little ones say, I want to go to Disney World. Yeah, so we work on realistic. The last one is mealtime hygiene, and I'm going to go through this fairly quickly. But you want to limit distractions. I know in the short term distractions seem to help, but they don't in the long term. They become distracting. So it's better to limit them now and to work on these other behavioral strategies that we've been talking about, because that's in the long term more effective. You want to limit trips. So if you know your kid's going to pee during meals, send them to the bathroom first. And that way when they say, well, I have to get up to go to the bathroom, you're like, really? You just went 5 minutes ago. You can wait till the end of the meal. You want to have everything ready before you call your kids to the table. There's nothing more frustrating for a child than being called to the table to sit and wait 15, 20 minutes while you get your stuff together. So have your food there, have everything ready for them. You want to model eating when you can. You want to prompt eating and recognize stalling. And then the other piece is you want to let them go. I know that we think of mealtimes as being as nice social opportunities, but your kids think of it as a break in their day that they would rather move on to something else. So as soon as they've gotten their goal, which is eating, let them go. That's going to be reinforcing. That's going to help them stay on track. If we were dealing with a picky eater, and I think some of you are dealing with a picky eater in this room, based on some of the things we've talked about, contingent attention, goal setting, token economy, mealtime hygiene, what are some strategies you might try to put in place? Just take a chance. You're never wrong.
We actually use the distraction strategy, all the things that you said you should not do in the previous slide, we do. And it works very well. It works very well for our son, and now we go to the stage that it also needs to work for our daughter. But to us, he is having his Lego, he's playing with his Lego, he completely forget that he needs to eat the vegetables, so he eats the vegetables. So
What do you do when he just plays with his Lego and he doesn't eat the vegetable?
he doesn't do that.
What will you do when he gets there?
Please eat your vegetables.
Great. Okay, so that's a great example. So let me give you get you guys going. Okay. So if you're going to be working on new foods, pick the easiest meal. If you know your kid's not going to do well at dinner because they're tired, don't pick dinner. They're tired. It's not going to work. So pick the easiest meal you can to introduce a new food. Always do it with a small amount. If you give them a plate full of Brussels sprouts, that's going to overwhelm them. If you give them a bite of Brussels sprouts, that may be more manageable. Present the food early in the meal. So if they're hungry, they're more likely to try something if it's presented early in the meal. But if you say, oh, well, you've had all of this, now I want you to try that, then you're going to get a lot more kickback from them because they're not as hungry. Use contingent attention. So again, encourage them to try. You want to get that bite, but if you can get a smell or a touch, or at least just let them have the meatloaf and the mashed potatoes touching each other and they're not freaking out over that, I take that because I'm going to shape behaviors over time. So I'm going to take that as a positive step forward. The important thing though with shaping is once you get to a place, you don't go backwards. So if my child will tolerate having Brussels sprouts on their plate and they'll touch them, then the next time they put Brussels sprouts on their plate, they have to at least touch them. They can't ignore them because you always want to build forward. You can use a token economy system. Your kids always have something they want to work on, something they want. You can set it up with, I'd like to work on this goal because I think it's something that's going to help us at meals. Let's pull this token economy system into place. You want to focus on the positive. So maybe they didn't take a bite today, but maybe they just tolerated it, or they sniffed it, or they touched it. Then focus on that and praise that. And then again, remember in introducing foods, you need to have at least 15 presentations before you can say, absolutely no, my kid doesn't like this, and move on. And I don't have this on the slide, but I think it's also helpful to only do one food at a time. I think it's overwhelming if you alternate back and forth between, like, you know, pudding and applesauce, pudding and applesauce, pudding and applesauce. If you really want them to eat pudding, then let's just do pudding every day for 2 weeks. Limited food variety. What are some strategies now that got you guys thinking that we could use to work on with that? I'll give you a hint. Contingent attention is going to be a part of most of these slides. So who wants to raise their hand and say contingent attention? Excellent. Good. That's exactly right. So again, pick an easy meal. Contingent attention and shaping. Remember, these are harder kids because it's not time limited. We're not thinking it's going to take 15 presentations and then all of a sudden they're going to love broccoli. But it's going to, if you stop, they're never going to like broccoli because you pull it off their plate. Yes?
I have a 14-year-old, going to be 15. He claims to be a vegetarian, but all he eats is grilled cheese and some dairy products and cereal, French fries. No meat. No vegetables. The only fruit would be in a smoothie. He's 14, 15. How do you convince him?
Okay, so...
How do you use this to help him get a bigger variety?
Okay, how do you increase food?
It gets worse as he's gotten older, because now there's the internet, and he used to eat Rice Krispie treats, and then he emailed Kraft Foods to find out if there were meat products in marshmallows, and they responded, yes, they use pork products, so now Rice Krispie treats are even out. You gotta go to Whole Foods and get vegan marshmallows at $3.50 a bag.
Okay, so what do you do with the, just to paraphrase, what do you do about the teenager who has unreasonable feeding restrictions? Sorry, that might have been okay. I have a 15-year-old. Man, she'd be in trouble if she got that picky. It's a hard one, but I think you need to sit down with them and you need to say there are foods that are not coming off your diet because they're foods that are healthy for you. And now,
Tall for FA, his BMI is fine.
Say, continue what you're doing.
you could tell him, you could say, look, you want the vegan marshmallows. They're like 3 times the price of the regular marshmallows. So do you give him an allowance? Yes. So why don't you take a portion of his allowance to pay for the difference?
He just won't eat it.
Then you move on to something else. Remember, the first rule was nothing comes off your diet.
He has poor appetite, so he'll eat less. He'd rather go down on his BMI.
So you can set that up. You can still say there's a token economy around that. That you need to maintain your weight. You need to eat this amount of calories. I'm willing to give you some flexibility on how you want to do it.
He won't even, he's limits on activities he can do, like school trips, scout camp, because he won't eat anything that's there. He has to pack his food with him when he goes on trips, because he won't eat anything that's
Does he pack his own food, or do you pack it for him?
Oh, he'll pack it himself.
Okay.
But, he's only going to bring bagels and cereal, and maybe if there's chocolate milk there, he'll drink that. So.
So again, with your limited food variety, I'm sorry.
With the money also, like David's offered him $10 to even take a bite of a cheeseburger. And no meat, though, because it's animals. We understand that part. We'll never get over the animals. And then he finds out that there's insects in peanut butter, 55 parts per million or whatever it is. And he gave up peanut butter. Oh my God, there's insects in it. So it's a huge issue. So we just try to ignore it, and maybe a girl eventually will teach him how to eat. That's it.
Hopefully one from Georgia whose maybe father grows peanuts. Yeah. So exactly. One thing you need to do is ignore it. But the other piece that you need to do is you have to set limits. And a 14-year-old can understand limits. He doesn't like them, and he'll push against them, but he can understand limits. And one thing that we didn't talk about, but I think it's really important to think about here in the context of ignoring, is a lot of families give up on ignoring because they tell me it doesn't work. And that's because they never get through the extinction burst. And I think there's a little bit of that going on with your son, too. So the extinction burst, the best way to describe it is my Coca-Cola machine. How many people have ever gone to the Coca-Cola machine or any soft drink? It doesn't have to be just Coke. They don't want to imply that they have the most effective machines. But anyone ever gone to the soft drink machine, you put your money in, you press the button, and nothing comes out? Everybody, right? Okay, what do? Do you walk away and say, dang it? Oh, do you kick it first? Or do you hit the button harder? Maybe it didn't hear me and you hit the button harder, right? And then eventually you kick it, and then I think this gentleman over here said you start shaking the machine, right? Eventually you're going to get either your money back, you're going to get your Coke, or somebody's going to come and talk to you about breaking the machine. But if you go back to that machine to get a Coke again in the future, are you going to just press the button? If you got your Coke by banging on the machine, what are you going to do first? Bang on the machine, right? Because why would I waste my time just pressing the button? And that's the extinction burst. So if your child gets a lot of attention from you with an undesirable behavior, and then you start to withdraw your attention, their reaction is going to crank it up a little bit. Maybe you didn't hear me the first time. Instead of kicking the seat in front of me, what if I start jumping and kicking the seat in front of me? And if you intervene at that point, then the child knows, well, if I jump and kick at the same time, Mom pays attention to me. So that's where they're going to start next time. And they're going to keep building up. And you have to get through this extinction burst where they try all possible examples of the behavior before they're like, it's just not worth it. And they either comply with what you want, or they listen to their peers and they start eating peanut butter. But I think there may be a bit of a extinction burst going on as well. That your son is, he gets attention for things that he pulls off, and he's just trying to see how much can I just be eating cheeseburgers all day long cheeseburgers you love, grilled cheese all day long before my parents really gave in to me. Okay, so limited food variety. Pre-MAC, reinforce with foods that are preferred. In this case, you want to reinforce the behavior, not the food. So it's not that you ate the carrots, it's that you tried something new. That's what you're going to reinforce. And again, using token economy as you can. In the interest of time, I'm just going to run through these last few things. Be persistent. So food intake, you're always going to start with contingent attention, especially bigger bites. If you can get them to eat more in a bigger bite, that's actually better. We have done studies which found that kids will eat the most of their calories in the first half of the meal. So you want to eat as much as they can when they first sit down, because their calorie intake is going to decrease over the course of the meal. So big bites we like. You've already talked about how to make sure each bite counts by getting lots of calories and fat in your bites. Try shaping energy intake over the course of the day, so you're not targeting one meal, but you're targeting multiple meals, so that you have a little bit, if remember going back to the variable food intake, if breakfast doesn't turn out the way you'd like, you can catch up perhaps with lunch and dinner. Again, using goals and the token economy. And then disruptive behaviors. So using contingent attention when you can, and using paired commands plus contingent attention. So sit down, I like how you're sitting at the table, would be an example. Stalling, take a bite. I have 3 girls. There's a lot of talking at dinner at my house, and there's a lot of, I want to hear what happened at lunchtime today, but you need to take a bite first. So I'm redirecting them back to their eating. Drinking instead of eating, try using a straw, and try limiting the amount that you make available to them. And if they want more, say you have to eat first. You finish this, then you can have something to drink. If they're getting up, you can have the rule that at meals we stay in our chair.